All right, welcome on in. This is All Things Odd. I'm Dr. Natalie Phillips.
I'm Dr. Hannah Galloway.
And I'm Trista Hauser-Smith.
All right, so today we have a really fun topic for you guys. We thought we would kind of revisit the audiology journey. And so we're going to kind of talk a little bit about how each of our journeys look different because of when we went through school, I thought. So we're going to talk, the first thing that we're going to talk about, and as you're listening, if you're an audiologist and you're listening, please start by posting in the comments maybe your journey as well. Maybe if it was similar, put a raised hand or, like a boo or a like or a thumbs up, whatever you want. But come comment with us and while we share. So I guess I'll kick us off here. And my journey was about I don't know, like 25 years ago, maybe. And so I started off doing a undergrad bachelor's degree of 4 years, and it was in communication disorders and speech science, and it was a Bachelor of Science. Then I went and did my Master of Science, which was just in audiology because you pick whether or not you want to do audiology or speech pathology. And then I did my clinical fellowship here at the time. Some people still kind of go through this. It's a little bit different, as you'll see, as Dr. Galloway talks through her journey, as well as Trista talks through her journey. But I had to do a clinical fellowship year. And then I actually had to work 5 years before I went back to get my doctorate because the criteria for the doctorate that I got, you had to actually work 5 years. And so I went and did that. And then after that, I had my AUD or the clinical doctorate in audiology. So that was my journey. I'm going to pass it over to Dr. Galloway, and she'll talk about hers.
Yes, and I think it was like 2006 when the audiology education changed from a master's degree to a doctorate. So if you graduated after 2006, you didn't have the option to get a master's degree because it didn't exist anymore. And so the people that already had master's degrees were sort of like already grandfathered into the field and still practicing and everything. But some of them did choose, like Dr. Phillips, to go on and do, like a distance learning program or something to go from the master's to the doctorate. When I went through, I graduated 7 years ago. And so I went from a bachelor's degree in speech language hearing that I got at the University of Kansas. And then I went to the University of Northern Colorado and got my doctorate of audiology. So you actually get your bachelor's, and then 4 years later, you get your doctorate. There's no like master's in between, which is interesting and different than a lot of fields. People would always ask about that, like how come you've been in grad school for so long, but you don't have a master's degree? So anyway, that's just kind of a little more information about that. And Trista and I actually went to the same school, so her education is pretty similar to mine.
Yeah,
Awesome.
my education is pretty similar. However, I started a little bit later in my life. Decided to have some kids before I went back to school, so definitely doable. But the funny thing is that when I was going through high school, college, I didn't know what I wanted to do. I dabbled in every single area, accounting, teaching, you name it, I tried it, and it just wasn't the right fit. But I ended up watching a show called House Hunters, and this lady on there was like, yeah, I'm an audiologist. I'm moving to Australia. And I was like, oh, what's that? So I ended up doing some research about it and found out that UNC was really close to my house. So I took some courses and realized, wow, I really enjoy this. So I ended up doing the last 2 years of my bachelor's at UNC, and I'm in my final year of my grad school at UNC as well, graduating in May. So all the same things that Dr. Galloway did, but just a little bit later in my life, and it's been a pretty interesting ride so far. So.
Yeah, and you bring up a great question, but before we get there, we're going to say hi to our friends that have joined us, also audiologists, Craig Casper out in New York. So he's here as well as our friend, Dr. Corey Workman as well, audiologist in Estes Park. He says bachelor in psychology and went back later for audiology. So that, Corey, as well as what Trista's talking about, it's interesting because sometimes like you don't always know what audiology audiology was. I actually didn't know either. I went in my bachelor's degree, I kind of sped through that, but, I went to school to become a pediatrician at first too. And then I thought, oh my gosh, like, I don't want to be in school for like that long to become a physician. And so, then I changed my major to drama. So I was a drama major for a while. And then all of a sudden, like communication disorders and speech sciences came up. And I was like, what is that? And it introduces you to speech pathology and audiology. And at the end of that, when I went to my master's, you kind of have to choose speech pathology or audiology. And so I chose audiology, but it's so interesting because sometimes it's kind of a wayward journey, right? It's not necessarily like, oh, I want to be an audiologist. I'm a senior in high school and like, what you want to do, right? And so I think it's super interesting that for some people, this might not have necessarily been on your radar. I just did a career fair for young men, for the Young Men's Service League, actually, so teenage boys. And it was kind of interesting because I had to explain to them what an audiologist was. And again, like, I don't even think it's on their radar, because they don't necessarily know what an audiologist does. So kind of really interesting here, which then brings us to the question of, what does an audiologist do? And I've noticed that I've got a typo. So I'm going to fix that because I think that it would bother Dr. Galloway. So let's fix this. All right.
That because when I was in my undergrad, my major was speech language hearing. I was a Spanish major first, and then that got to the point where I didn't really want to like analyze literature. I just wanted to speak Spanish. And so I decided to change my major to speech language hearing. But so audiology was not in the title of my degree, but I was a junior and I was Googling, what is an audiologist? Because our program was really speech focused. Most of the people that graduated from my bachelor's program just went into the master's in speech pathology, and that's what was on the same campus as us. And so that was like kind of the typical avenue people took. And so, yeah, I got all the way to junior year and then was Googling, what is an audiologist? Like what settings do they work in? And decided that was something that I wanted to pursue. So, yeah. I think it's a lot of people's radar.
And then also, like, when I was in between trying to figure out speech pathology and audiology, I, at the time, because I actually did my undergrad here at CU Boulder. And so it was interesting because huge deaf community, right? And my American Sign Language teacher was amazing. And she was a CODA, or child of a deaf adult. And I asked her, I said, look, I said, I've got to choose whether I go into speech pathology or audiology. And I said, which one would the deaf community, right, with a capital D, deaf community, not like more if you were forcing them to speak or if you were forcing them to hear? And she said, look, she said, whatever you choose, you be an advocate for them, whatever you're doing. And so it really doesn't matter, right? And so she kind of released that pressure of being able to like having to choose and trying to stay within the deaf community and all of that. So it's really interesting. Corey says audiology was not on his radar. He headed into marriage and family therapy and then stumbled into audiology. Interesting. We'll have to talk about that a little bit more, Corey. Yeah. That's really interesting. So thanks for sharing that. Okay, so what does an audiologist do? So I thought it would be kind of fun to kind of go round robin. And again, if you're watching and you're an audiologist, or maybe if you're a patient watching and you're like, I know what an audiologist does, like, put it in the comments, right? So we can kind of share just the awareness, because even if you're an audiologist or not, it's always good to kind of practice when you get asked that, like, what do you do, right? And you can give the standard elevator pitch or answer, whatever. So I thought it'd be kind of fun to kind of practice this too. So initially, when I was looking at this question, I thought, okay, we diagnose and treat hearing loss, tinnitus, dizziness, whatever it is, right? And then I throw in a few things here and there. We work with the brain concussion specialist, but it ends up being this whole mumbo jumbo of things. And it's like, oh, and then we do this. Oh, yeah, and then that too, right? And so I thought we could kind of practice and spread awareness as well. The other thing that I, so that's usually my standard answer, and it's kind of just a big mess. And then the more I thought about it, though, like, because I've got a business outside of audiology that connects people, I thought, you know what? My strong, inclination to get people connected to each other really started in audiology, because connection is so important to me, right? And so then I thought, okay, well, the way that I could explain audiology is we're connecting people back to life or back to, their loved ones, right? Because when they come in, you think, okay, we joke about the husband wife that comes in and, oh, well, you got to make him hear, or you got to make her hear, or she's not hearing me, or I'm turning up the TV. So I thought, you know what? It really isn't about hearing or listening,
Mhm.
right? But it's about connecting people back to life. And so that's what I say now is I say, okay, you know what? As an audiologist, I connect people back to life and back to their loved ones. And then that's it. That's all I say. So I thought it'd be interesting to see, if you were asked that question, we'll start with Dr. Galloway too. What would you say? What does an audiologist do?
Yeah, so my standard answer is diagnose and treat hearing and balance disorders. But as I was writing that down, I don't treat balance disorders. I mean, because there's a whole wide gamut of balance disorders. And, we can't, like Dr. Workman that's tuning in. I know he does like the Epley maneuver in his clinic. So he is treating, positional vertigo. But I didn't think it was fair to put it under this huge umbrella because technically there's a lot of other vestibular disorders and there's PTs and OTs that are really kind of, the expert at some different thing. So anyway, I don't really think diagnose and treat hearing loss and balance disorders is accurate. And actually, it's funny because I was going to say we help people communicate because I think that that's a big part of it. And also Dr. Workman saying, he was going to go into like family marriage counseling. Sometimes our jobs border like, there's only so far that you can talk about the disruption in communication before you talk about the actual issue with the spouse or the loved one. And so, I see a lot of parallels between counselors and therapists and audiologists because there is a big portion of it that's counseling and teaching somebody, what we can do to help them kind of get back to what they had or, that ability to communicate effectively.
I love that. I love that. All right, Trista.
Well, I think for me, just because I'm just starting out in this, obviously the communicating the connection is such a huge component of audiology. But I also like to think about it as me empowering my patient to take their hearing and their balance health into their own hands, like providing them ways of being able to work through something or something comes up. Let's figure that out together, but putting it in their hands to where they have some control over that, where they're the ones making the decisions, and so they're the ones that are actually actively pursuing this. And so I really love to empower them in that.
I love that. All right. So we've got connect, communicate, counseling, and then also empower is what I'm writing down here. And then our friend Corey says, I spend a lot of time counseling people on communication. I feel like a therapist much of the time. That is so true. That is so true. There's a lot of things that we counsel, couples, families, whatever it is, staying in our realm, right? Staying in our scope of practice and surrounding this communication barrier and hearing, of course. But yeah, I do feel like we do a lot of that. So I've got connect, communicate, counsel, and empower people. So that's awesome. All right.
Well, I think too that part of the empowerment piece is there's so much research being put into preventative medicine and holistic medicine, and what happens if we don't treat hearing loss for 50 years? What else could possibly come along with that? And so I think that it's a lot more easy to empower somebody now because we have this long-term data to say, okay, like the risk factors of dementia. That's like my favorite study, right? But just as telling people like these numbers don't lie. They followed people for a really long time and it was a really big sample. And so I feel like it's easier to empower patients, when you have that kind of research in your back pocket, which people have put the time into, in the last decade or so to really look at that.
Yeah, absolutely. All right, just checking here. Oh, and also Corey says I do collect a lot of earwax. I'm wondering if you have a little trophy room or a trophy case, Corey. Just answer us and let us know because I don't know, that's a little disgusting. But yes, collect a lot of earwax too is what we do. Some of us anyway. Okay, so then the next question is where do audiologists work? So let's kind of go around and talk about where maybe you've worked, or if you're still in school, or just haven't had a lot of placements. Talk about where your placements were too, right? And then let's kind of make sure that we cover all the areas that we know that audiologists could pop up in. So for me, let's see, I worked in I'm trying to think, do I do recent to old or old to recent? So I'm trying to think through this. Okay, so I was in a hospital. I worked for Kaiser, and a private practice. And then, I set up newborn hearing screening programs all over Texas. And then I was in a hospital clinic at the University of California, Irvine, in the Department of Otolaryngology and Head and Neck Surgery. And then I moved my way up to another private practice and then a multi-specialty clinic. So we were within an ENT department, but there were 200 physicians and providers there in the same building. And so that one was kind of interesting because even though we were with ENTs, we were not close. And so the other audiologists and I had to go and market ourselves to some of these other physicians within the same building just to let them know that they could actually send patients that had dizziness to us first, let us do the actual testing, and then we can figure out which specialty it goes to. So that was an interesting concept for me. And then ended up with another ENT, and then now back to private practice. And so that was kind of where I covered. So private practice, ENT, hospital, clinic, and actually setting up newborn hearing screening programs. So that was my areas where I worked in. What about you, Dr. Galloway?
Yeah, so I've worked at this private practice that we just started, and then before that, I was at the same ENT clinic with Dr. Phillips, which I thought was a really great setting to start my career because you see a little bit of everything in ENT and a lot of surgical ears, get a lot of pre-op and post-op audiograms, which were really interesting. Reading a lot of op reports, I really liked that. Just learning about how the surgeries, of the middle ear are done. That was really fascinating to me. And then also we got to dabble in, cochlear implants and pediatrics. We would be able to do ASSR, auditory steady state response, which is a test that you can do to figure out hearing sensitivity. If you have a child that we're, not quite sure where their hearing loss is, you can do it with newborns too, or even adults if the patient can't respond to you. So that was really interesting. And another area that I was in for an internship was educational audiology. So in the state of Colorado, audiologists have to do an educational audiology internship, which is different than other states. And I think it exposes all of us to that setting because it's, maybe not one that people think of off the top of their heads, but essentially there's usually one or more audiologists for the district. And so when they do those school hearing screenings, the kids that don't pass the school hearing screening get referred to the audiologist. And each district has a building that has a sound booth and a typical audiology office. I guess smaller school districts contract out. There are some audiologists that drive to like several different small towns. But anyway, you check up on all of those kids with known hearing loss, kids with hearing aids, kids with auditory processing disorder. You do a lot of FM system stuff. And so that's totally just a different realm of audiology that I was, lucky enough to experience at my internship. I could see, maybe later in my career or something that being more appealing, but I really liked the fast paced kind of nature of ENT and now private practice, how we've kind of branched out with more medical things like bounce and cochlear implants, because I think it keeps things interesting.
Yeah. How about you, Trista?
So for me, in the beginning years of grad school, there was a clinic on campus. And so we did the first couple years of rotating through with different supervisors and seeing patients in that clinic. And then for my internship, I did a private practice setting for 8 weeks and then a school setting for another 8 weeks. And at the private practice setting, I was at 2 different locations locally. And so I got to work with a couple different supervisors. And then now in my externship year, which is a full year long, I've been mostly at the VA and working both at one VA system where they actually have a whole hospital setting where they'll do balance and dizziness testing, and then at a local VA system where they don't offer that. And because they don't offer things like pediatrics or vestibular, I've been doing this last semester here at the Audiology Center of Northern Colorado, so I can get some of my hours with that area.
Awesome. Yeah. So We covered private practice, hospitals, clinics, schools, like education areas from like K to 12. We talked about, university teaching professors, you can also be there. Manufacturers, audiologists pop up obviously in like hearing aid manufacturers, cochlear implant, technology manufacturers related to the ears
Mhm.
and hearing. And then the VA. And I'm trying to think, is there anything
Occupational
else?
audiology. That was one that I
Ah,
was, or like industrial audiology. There are some audiologists that work with they go into factories and do, hearing screenings and all of the mandated OSHA required testing. People have to be tested every year. And then if they develop a hearing loss, that has to be like looked into further. That was one piece of audiology that even in my doctorate program, I didn't know existed. The other thing that I thought of was forensic audiology. So there are
ooh.
people that actually are like audiology detectives that, actually look at forensic audiology, which is pretty cool. So,
Yeah. That's right. I actually, when I was in my master's degree at the University of Hawaii, one of my professors, I was in another program for interdisciplinary studies, and I traveled to American Samoa, and he happened to be there, and he was doing industrial readings, and he invited me along. So I actually went to a tuna packaging company in American Samoa, and it was chicken of the sea. And we walked from the beginning all the way through the whole packaging like process all the way
mhm,
to the end. I mean, like they were picking out bones from the tuna,
yeah,
everything to the packaging process, and measuring every single place to make sure that they
mhm,
were within OSHA standards. So that was kind of cool. He wrote up all the report.
yeah,
I didn't have to, but I got to go around and actually do that. So I thought
yeah.
that was kind of fun as well. So I'm glad that you brought up the industrial part.
Yeah, as Trista and I both, we took a noise class. And so we learned all about how to do dosimetry, which is where you go into places and actually take noise measurements. When I was in school, we were working with New Belgium. And so the University of Northern Colorado has a mobile audiology testing trailer. And so we had contracts where we would go out to these different factories and test the workers. And some of them, were on 12-hour shifts. And so it would be like the night shift. So the trailer would have to be there for like, I don't know, 48 hours or something to like capture everybody. And I
Wow.
went to Leprino, the cheese place in Fort Morgan. And one thing I really learned a lot about was the job titles. It was like we were just like scanning through them. We're like, okay, now it's the packagers, and now it's the cheese weighers, and now it's the like all the different job types. We went to JBS, which is a meat packing
Yeah.
facility, and we did testing there. And I did my dosimetry study, or the one where I actually went and measured the sound levels at New Belgium on like their packaging line, which was really cool. So yeah, whole different world of audiology.
Yeah, it was funny. I was just at a CSU basketball game, and they usually have like the noise level going up on the RAM, but they started to show a sound level meter being held. And with the
Oh, that's
crowd,
cool.
right? Because it's Moby Madness. And so with the crowd, they actually showed it. You guys, it went up to 115 decibels, which is
Hmm.
huge. And again, we'll probably have to cover then, now that we're talking about it, the noise levels, safe noise levels. I know that we've touched upon it in previous shows, but yeah, 115 decibels. And I kind of looked at that, and my kids were kind of looking at me kind of sheepishly going, Mom, are you okay? And I was like, yeah, I'm gonna, that's why I'm in business, So I thought that was pretty funny. But yeah, that was really, really loud. But it was for a short time. So yeah.
Yeah.
Awesome. Okay. And then our last question that we have is, what do you love most about audiology? And I think that my most favorite setting, what was interesting to me is throughout my career, I've been in a lot of different places. However, it always had the background of being in kind of the medical side of audiology,
Mhm.
mostly with ear, nose, and throat physicians, neurotologists, things like that. And so what I learned on a couple of just throughout my journey is number one, negotiations and standing up for yourself and communicating with physicians. That's number one that I learned to do. And then number two, I think one of the biggest things that I love about being in that medical side is putting the pieces together for a patient. Being able to do some different diagnostics and saying, oh yeah, I can figure that out, or by the history, or by looking at my diagnostics, putting together the pieces of, hey, this is what I think you have, but why don't you go and this is the report I'm going to send send to your ear, nose, and throat physician or to your primary care physician, or whoever it is, suggesting that your test results look like this blank, right? That's, I think, one of my most favorite things is in being part of this side. And even as a private practice here, with our new practice, it's been fun because we have been able to still continue to do those diagnostics to be able to put the pieces together for physicians. And we have an amazing brain concussion specialist that we work with. And so luckily we get to see some really interesting cases, and it's kind of fun to do. So that's probably my most favorite thing that I love about audiology is the medical side of it, doing the diagnostics and really understanding the disorders that will come out because of these diagnostics that we can do.
Yeah, I would say that I love the sort of treatment that we get to do. Cochlear implants and hearing aids are my very favorite because you can take somebody who, just 2 weeks ago was telling you how many difficulties they're having at work and then fit a pair of hearing aids on them or activate their cochlear implant or whatever. And there is a huge difference in their life. They have access to all of this that they didn't before. I think that's my favorite part to practice. I also really like research, and I don't really do research myself, but I think that the ear is very fascinating. And my daughter is almost 14 months old. And so we're teaching her, where's your nose? Where's your ears? And she has the ear book that my friend sent her. And so my husband said something like, your mom loves ears. And then he said, but do you really? Or is that just, I'm like, no, I really do love hearing, and hearing and speech science is so interesting to me that I really will chat somebody's ear off about it. So I was just telling my patient earlier today about a chicken's vestibular system because it's totally interesting to me. So anyway, yeah, I really love research, but I really love the moment when you can treat something and really see that difference that it's making for the patient, like immediately. That's so gratifying.
That's so cool.
I think for me, like I said, I'm just starting out in this, but I really love the diversity of the things that I get to do. I really enjoy everything, all the hearing aids, hearing evals, tinnitus, balance, vestibular stuff. And I love that this profession offers me so many things that I can dabble in. And I get excited when I actually get to see different things and do different things and get my hands in it. And just like Dr. Galloway, I really enjoy research. I don't know if I could ever be a researcher, but I love like the beginning and the end product and just maybe figuring out something really cool in research. So I'm very excited about everything that will be coming in the future for all of that.
I think there's so many things to be passionate about in audiology. I feel like we can make another round too. But now you see why. So we used to do the show with our practice from before, and we've changed up the format a little bit. I like it because we do have some open topics. Usually we have open topics, or sometimes we come up with a topic of the month that we focused on. But our format really covers some open topics that we kind of just come up with. But we also have two new things that we're just very intentional on covering because we have a heart for both of them. Number one, as you can tell from both Trista and from Dr. Galloway, is research. And so we have a research spotlight that we're going to do every month. So if you've looked at some of our previous shows, or if you've missed some, head to our Facebook page or our YouTube channel, and it's kind of scrolling down at the bottom here. But you can catch our latest episodes, and we do have a research spotlight and a philanthropy corner. That's the second one that we're very intentional about making sure that we can cover different philanthropies that are related to hearing, to amplification, anything related to audiology as well. And so it's funny that both of you guys said research. I'm like, that's where the research spotlight came from. And so, because of that, it's really fun to be able to keep up on some of the latest things in research. So that's just, again, a way that we can kind of spread awareness of what we do. So if you have any other questions, final thoughts from either of you guys at all?
I don't think so. This was a good
awesome.
one. I liked hearing everybody's, the different parts that we like and kind of the journeys. Because I've worked with Natalie, Dr. Phillips for a really long time, but like I hear new things like about the American Samoa tuna packaging facility. That sounds like an interesting experience I haven't heard of. So
yeah, it was so much fun. It was so much fun. Yeah. All right. So with that, we are going to end today, and it was a lot of fun. Hopefully you guys will continue to comment if you have any questions for us, or if you also are an audiologist audiologist or someone who knows what we do and would like to just kind of spread the word, or share this out, share it out on your pages as well. It is here on Facebook. It will be here on Instagram as well as YouTube and LinkedIn. So no reason not to share it and help spread the word of what audiologists do. And with that, we will be back next week with a whole new episode. We'll see you then. All right. Bye.
Bye.